Holly is an accredited exercise physiologist who's been practicing for 5 years and working in the exercise science field for over 10 years. She specialises with working with individuals who are currently going through or have gone through cancer treatment. Currently, she splits her time between working clinically with individuals at Inform Health and Fitness Solutions and at SAMRI, where she's currently completing a PhD. You have my sympathies. In the area of exercise oncology. When she's not at work, she loves playing hockey and chasing after her border collie. So welcome, Holly.
My name is Holly Evans and I have been working clinically, but I also have this research up my sleeve. And so the first thing I thought I would do is actually, when asked to do this talk, is go through the literature and actually see what the literature says about exercise prescription and NETs. And sadly, there's nothing. Yeah, so I can understand how when you're diagnosed and you kind of have these questions floating around, there's actually nowhere really to go to in terms of finding a bit of support or reference. So I guess today what I wanted to give you is a bit of the scope of the general exercise prescription field in oncology. We've been lucky enough that Australia is actually one of the leading forces in Australia in exercise oncology, especially at ECU in Perth and in Melbourne. But one of the big leaders in exercise prescription in cancer, her name's Prue Cormie, and she always talks about this idea that if the effects of exercise could be put into a pill, then it would be prescribed to every patient with cancer. And it would be funded completely and it would be everywhere and every patient should be asking for it. So I guess I wanted to give you a little bit more information about why that actually is, because the idea of doing exercise when you're actually not feeling very well is completely off-putting, and rightly so. But before I do that, I actually wanted to just get a bit of an idea of who has actually heard of an exercise physiologist. That's actually pretty good. So has anyone actually gone to see one? That's not bad. I'm impressed. That's pretty good. So essentially we're a 4-year trained allied health profession, and we really look to use exercise as a therapy alongside other treatments. But we're very much trained in terms of taking a holistic perspective and working in multi-D teams. So working with oncologists and your GP to help actually give you a really appropriate exercise prescription. So as you may or may not know, COSA actually came up with their position statement that said that exercise should be embedded as standard practice in cancer care and used as an adjunct therapy. And we've been lucky enough, as I said, that there are a lot of guidelines now around what you can be doing and what the evidence is saying. And the big probably take-home message is to avoid inactivity. That's the first one. So I'll go through a little bit of the reasons why, but the other issue that I find is that they keep saying, all right, you've got to be working towards doing 30 minutes of exercise every day and you've got to be doing resistance training. And there's a lot going on in your lives, both from a medical setting but also from a daily life setting, that this may not be suitable. So the latest guidelines, which is really exciting, now talk about exercise being tailored to you. So that's the biggest point I'd like to make. And that if you want service, heading to an exercise physiologist is a way to go. But why? So the overall literature, and this was across a whole lot of systematic reviews, I think it was 38,000 breast, colorectal, prostate and mixed cancer patients found that completing a standardised exercise program resulted in a 37% reduction in the risk of cancer-specific mortality. So that is a drug. I'm pretty sure if oncologists had that available to them, they'd be pretty happy. I do want to make mention though that this is in those populations, so we can't correctly say that this would happen in NETs, but it's still pretty exciting. And I think the research is coming as you guys have been working so hard. I think, breast and prostate are really big in this exercise prescription field, but they're starting to look into pancreatic cancers and bladder cancers. So I think you'll see sadly, as time progresses, there will be studies in this area. So why? So probably the biggest thing at the moment is there's a lot of animal models, and they're starting to move into human models. But the first thing that they've noticed is there's a reduced inflammation within the body that drives cancer cell death when you are exercising. So there creates this really nice environment in the body when the body is moving. And it also helps increase natural killer cells. It reduces, too far, sorry. Got a list. My brain doesn't work on a Thursday night, unfortunately. It also works epigenetically, so it can affect your telomere length. It can affect your platelet adhesion and platelet clotting. So all in all, it actually has this really nice beneficial effect within your body that you don't even know. And while it's not going to be the be-all and end-all, it certainly can help when you're going through these other treatments to add this extra force of exercise on top of it. And then the next question is, when should I be doing it? So you obviously, public health statements are always like, let's be active, get out there, get moving. And then you're diagnosed and your whole world shifts. And so then you start thinking, when do I do it? What do I do? Do I wait till I've had treatment? And one of the studies have now shown that there is a whole range of time that you can exercise, from before diagnosis all the way up to whether or not you're in palliation or not. They have differing effects. So what you're doing pre-treatment is going to be different if you're in a palliative care status, but they can all have really big effects on your quality of life, but also your hopefully longevity. And when we talk about exercise, we hear a lot of, just go for a walk. Walking's great. The biggest problem is exercise is not just one drug, it is many. So we look at aerobic exercise, which is you're going for a walk, but there's the longer walking, and then there's the shorter, quicker, getting your huff and puff going. They create two different things in your body. Then you've got your resistance training, so you're lifting heavy objects. Do you want to improve your muscle strength? Do you want to improve the endurance? Do you want to improve your power, or do you want to have more muscle mass? This all has different effects depending on what's going on. So if you have been diagnosed with diabetes, actually increasing your muscle mass size increases the amount of blood glucose that sits in the muscle cell, which is fantastic because it's not floating around your bloodstream. Whereas if you're, say, going through chemotherapy, you may find that you're actually looking to get more aerobic capacity, because one of the things chemotherapy does is it reduces your VO2 max, or your ability to move for an extended period of time. So, and the last one is looking at flexibility and mobility. But so when someone sort of starts talking to you about exercise, it might be interesting to start thinking about what you need and what treatments you're going through, rather than just a really blanket statement. And this is a very big graph. I don't expect you to get too much into it, but the first thing that we look at is deconditioning. So with any treatment that you go through, you tend to have some form of fatigue, and it interrupts the general strength and capacity that you might have. So we all know that strength training will improve your strength. We know that aerobic training will improve your aerobic capacity. That's all the first thing that a lot of these studies showed, that yes, it's safe, exercise is okay in this population, and it improves these factors which you would see in everybody sitting here, whether ill or completely healthy. But the next lot of the ones are the ones that I really am interested in, and I think it's really exciting. So exercise is the best non-pharmacological treatment for cancer-related fatigue, without fail. It's really exciting, and it seems really silly that exercising makes you feel less fatigued. But it's those days where you're not feeling very good and you just kind of get up and move around the house and you actually start feeling a little bit better. That's because you're actually putting oxygen into your system, you're having changes in your hormonal system, and they're the really exciting things. There's also improvements in your quality of life, your ability to do more, your mood, your stress and anxiety, and it also just tends to make you feel a little bit better about yourself. And lastly, some of those long-term, you guys have got this cancer and you tend to last a very long time, which is very exciting, especially for some of these new treatments that are coming out. But there are some long-term complications. So exercise can improve your cardiovascular disease, it improves your metabolic health, and the last one that I've popped on is some new research that's actually saying that if you exercise while going through chemotherapy, you can actually improve your ability to withstand the treatment and get the full dose and the full benefits from it, which is very exciting. So what do you need to think about if you're going to start an exercise program? So in terms of if you were to come see an exercise physiologist, they would do a patient assessment, and that takes into account all these different things. So it's not you get the same prescription as someone else. They take a look at what your disease is, what your treatment side effects are, what other symptoms, comorbidities that you're dealing with. What do you want to get out of it? Some people just want to be able to pick their grandchildren up. Some people want to go for a trip to the Himalayas. You know, those sort of things can be implemented into your program, so it's not just a boring thing that you're forced to do, but it can actually be something that's motivating. The other thing that I thought was interesting, and it'd be interesting to get a bit of a poll, but symptoms from exercise are another one that I think you guys would have to be acutely aware of. So things like flushing. Is anyone happy to share any specific side effects that they get from exercise that they may not have thought they would? Nothing? No? Cool. So I guess the reason why I ask is I've heard a little bit about flushing and things like that, and I have read that exercise can increase that, but there is not enough evidence to say that that's a common occurrence or not. So I was just interested to see if that was something anyone has actually noticed. So I think that's one of the reasons why I highly encourage you to track what you're doing. If you say you are working with an exercise physiologist, they may tend to ask these questions, but if you're actually looking to just go into a community setting like a gym or do something at home, just track and see what's actually going on. And so you may be able to tailor your own exercise to what's going on with you to make sure it's as enjoyable as possible and also as safe as possible. So just a couple of quick things about a couple of the different treatments that you may have had and why exercise may fit in or what you might need to do. So if you have had a surgery and you know that you're leading up to this surgery, prehabilitation is so important. So making sure you are as fit as possible so the anaesthesia doesn't affect you as much, and making sure you're as strong as possible. So it's expected that you will decondition after surgery, everyone does it. But if you start at a higher point, you're not going to decondition as much. So that's really important. Generally, they will say about 6 weeks is a minimal healing time to make sure everything's nice and healed. And so, you know, not necessarily starting vigorous exercise, but starting small little movements before that time and using pain as a guiding factor more so than anyone else, because everyone is very different, so how you heal is different. Using a multimodal program, so make sure you're doing strength training as well as aerobic training, so you're increasing your conditioning of both, and beginning really slowly, seeing how your body deals with it, and then just add little bits to it. Chemotherapy, this one's been studied quite a lot, which is really exciting, but they talk about when exercising to periodise your exercise. So say you're on a 3-weekly cycle, you have your dose, 3 weeks later you have your second dose. What you'll do is 2 to 3 days after your chemotherapy, no doubt you're feeling awful, your exercise dose is very small. Don't try and do anything else, just pick a small thing. So that might be walking to the letterbox, and that is your exercise tick. Well done, good work. as you're building up to your next dose, you're starting to feel better, and you just increase your dose of exercise or your resistance training. It seems like a really obvious answer, but we hear a lot of people feeling a lot of guilt for not exercising when they're going through chemo. And so if you take the guilt away and go, all right, this is how much I'm doing, and then I'm building up, then it tends to take that away, and that becomes sort of a little bit more motivating. The other thing they're talking about now is auto-regulation. So when you wake up and you feel awful, just do 5 minutes. Start with 5 minutes. If you listen to your body and your body says, this is not happening, stop. That's fine. But if you start those 5 minutes and then you actually start feeling like this is something that you can do, you're already going and you're off. So give yourself the ability to regulate what you do based on how you feel when you wake up. And this is very important when we look at what side effects and things you're going through and what stages you're going through. But lastly, the big tables that I put up that spoke about completion rates and reduction of fatigue and improvement of quality of life, they're all really acute benefits. So when you're really not necessarily feeling like doing something, think about those. Like, this will make me feel better today. And that's a really cool way of looking at it. And if you're just in that period of just watching what your tumour's doing and you're not actually having any active treatment, think about making exercise as your proactive choice of medicine. So this will improve your capacity, same that we spoke about with surgery. This will make you as strong as you can be, so when it comes to the time that you say you may have surgery, you're good and you're strong and you'll recover from the surgery better. But it definitely gives you a control. If there's one thing that you can do, you can make yourself strong and capable and resilient. So if you want to start or modify, here's a couple of key points. Start small. Don't go crazy. You will end up sore. Everyone does it. So, you know, when I'll go for a 3K walk and then you kind of keep going and then you end up bedbound for 3 days. Don't do that. That doesn't end well, and it doesn't make you want to go again. Start off with a 5-minute walk. It may not seem like much, but when you start building it up, in a month, you're doing a 3K walk and you're feeling good. Try and stick to resistance training and aerobic training. If you need help with resistance training, exercise physiologists are there. And for each session, just start. Just do something, because you may actually enjoy it once you're going. And some people just don't like exercise, never have, never will. Just think of it, if you're like that, just think of it like your treatment and think about the acute benefits you'll get. Now, this is a really big slide and I don't expect you to be able to read it, but essentially what it talks about is when you shouldn't exercise. And I can give these slides to you. These are the ones that are no-no. So when your platelet count is down, if you have an acute infection, if you've got high levels of shortness of breath or gastrointestinal distress, then you definitely have the right to just give yourself the day off. So just quickly, what are your options? You can, if you're going to see an exercise physiologist or a trained physiotherapist, I should have said that, you can have one-on-one sessions, you can have group services, or you can even just have one-off consults if you just want to chat to someone and make sure what you're doing is in line with what you probably should. To see them, you can use a team care arrangement that's put in place by your general practitioner. You get up to 5 sessions with any allied health provider. You can use your private health. You could use income protection if it's available. There are some hospital-based rehab programs. You can use your own finances, and then hopefully we'll see some research projects coming soon, and that will all help you. But I challenge you to think of this as an investment in your own health and as a treatment form. Yeah, thanks.